Yep, we're ready for today's live. I'm just gonna wait as usual for you all to join. Hello, Israel. How are you doing? Trust you're doing great. Hello, Gabriel Noye. How are you doing? Trust you're doing great. Hello, Wiseman Dean. Hey, how are you all doing? Trust you are doing great. It's a beautiful evening over here. How are you all doing? If you're watching this live, all you have to do is to leave a comment in the comment section and also double tap and like the video. Let's just give them some minutes to join the live. Let's give others some minutes to join the live. And feel free to share this live section to your loved ones that you feel they will be interested in this particular topic, please. Wise Madin said, watching from Balantry, Malawi. Hello, Wise Madin. Thank you for joining our live. Israel, I'm good, and you? I'm great. We have Baloyi Foster. Baloyi Foster, how are you doing? Trust you are all doing great. I believe we've seen the topic of today's live on the video already. You already know what we are going to be talking about today. So if you know what you're going to be talking about, can you please drop in the comment section? If you saw the full description of the video, can you drop in the comment section what we are going to be discussing today? Yeah, can you drop on the comment section what we are going to be discussing today? And if you are joining this live, welcome to Nurses Lecture Room. Before I do the introduction, I just want to know if you have an idea what we are going to be discussing in this live video today. So if you have an idea of what we are going to be discussing here today, I want you to drop on the comment section. Wise Madine said, I'm good here. It's just a few rain. Oh, that's good. That's good. That's good. You need the rain. You need water generally. If you know what we are going to be discussing on our live today, can be dropped on the comment section. And thank you all for double tapping and liking the video. For those that have not done that yet, all you have to do is just double tap your screen and it automatically likes the video. And if this is your first time coming across this channel, my name is Mercy Mary. I am a registered nurse midwife from Nigeria, but I'm currently practicing in the United Kingdom as a registered adult nurse. That is what I'm currently practicing as. So if you know what we are going to be discussing here today, just drop on the comment section. From the title, do you know what we are going to be discussing here? Or you just came because, oh, it's Nurses Lecture Room Live. Let me be here. Do you know what we are going to be discussing here today? All right. So hello everyone officially and welcome back to Nurses Lecture Room. Today we're going to talk about a subject that is often whispered about. They don't say it loud. You say, yeah, people, like they say it, they whisper it. This subject is often whispered about. You don't hear it, but people are actually passing through it. And that is pain during sex. Pain during sex. This is a very, very important topic. And this pain during sex is known medically as dyspareunia. dyspareunia, which is dyspareunia. That is the medical term. So this section promises to be a safe space, a shame-free space where we are going to get real, we are going to be respectful, and it's going to be an educational section. Whether you are here for yourself or you are here to support someone, you are in the right place. Okay? If you are here to support someone, you are here for yourself, you are in the right space. Remember, like I earlier said, this section is going to be safe, shame-free, and we are going to be real as much as we can. We are going to be respectful to each other, and this video promises to be educational. And while typing on the comment section, YouTube might restrict some comments. So if there's a way you can remove some letters just to modify it so that YouTube does not remove that question, so that YouTube does not remove that comment, kindly do. So like I earlier said, this is going to be an interactive space. So it's going to be me and you talking. It's safe and it's shame-free. So the first question I'm going to be throwing in the audience is, have you ever experienced pain during sex? It's a sincere question. We are all matured here. Like when I was starting this life, I said it is not meant for kids. So have you ever experienced pain during sex? Yes, no, or you prefer not to say? Kindly drop on the comment section. Feel free to remain anonymous. Like say, yes, I have experienced pain during sex. No, just say yes or no, or I don't want to say. Just drop in the comment section. Have you ever experienced? Why I actually want people to share it is for others to know that they are not alone. Because when we share our like how we feel, other people are able to know that they are not alone in this. Other people are able to know that, okay, I'm not the only one experiencing it. And those that have not experienced it, if they experience it in future, it's not going to be something strange to them. So that is why I'm asking this question at the very beginning. Please and please, have you ever experienced pain during sex? Is it a yes? Is it a no? Or you don't want to say? Just drop in the comment section. So we have someone in the comment section said, yes, I have during pregnancy. Okay. Somebody said sometimes. Another person said, yes, I have. So do we have more answers? We have up to 25 people watching this live. I would like more answers. Let me know before we go into the comment section. Before we go into the topic proper, I mean, because on this particular video, we are going to be talking about what causes that pain during sex and the different types of pain you experience and what could likely cause that type of pain. Because for you to prefer solutions to that pain, you have to understand what causes it. It's not just one thing that causes pain during sex. There are different things that cause pain during sex that we're going to be discussing in this particular video. So Wise Madin said yes. Foster said no, but I have another problem. What could that problem be? You can drop in the comment section, and when I get a break, I'll be able to answer it. So we've gotten some answers. So let's go straight into the topic proper. So like I earlier said, pain during sex is known as dyspareunia. So dyspareunia is the medical term for persistent and recurrent pain during or after sexual intercourse. So if you as a lady, you're having pain during or after sexual intercourse, it is known as dyspareunia. Generally, pain during sex, it affects all gender. It affects all gender. But today we are going to be focusing more on people with vagina and vulva. Yeah, because it tends to affect them more. You heard me right. Pain during sex affects all gender, be it a male or a female. But on this particular video, we are going to be attending to those that have the vaginal and the vulva because pain usually affects them more. All right. So now let's go into the various causes of pain. When it comes to the causes of this pain during sex, you might be watching this video on behalf of your wife. You might be watching this video on behalf of your partner. So I'm going to be breaking down the causes of pain during sex into three. First, we have the physical causes of pain during sex. Secondly, we have the hormonal causes of pain. And thirdly, we have emotional / psychological causes. What did I say? We have three causes of pain. The first is what? The physical causes. The second is hormonal causes. And the third is emotional and psychological causes. So I'm going to be breaking these causes down and explaining it. And at the end of this video, you are going to be telling me the one which you experience. Like I earlier said, this is a safe space. We are not shaming anybody. Feel free to express yourself in the comment section so others can also learn and you can also learn while you ask your questions. So first of all, let's talk about the physical causes of pain during sex. What are the physical causes of pain during sex? The first physical cause of pain during sex is actually infection. Yes, when a lady has infection, she's likely going to experience irritation of the vagina. She's going to experience pain during sexual intercourse. These infections could be urinary tract infection. We're talking about urinary tract infection, infection that affects the urethra. We're talking about the clitoris that affect the bladder. Those are the urinary tract infection where she pee. So urinary tract infection can cause pain during sex. Then the second is sexually transmitted infection. Sexually transmitted infection can cause pain during sex. Yeast infection. Yeast infection, one of the signs of yeast infection is cottage cheese discharge. So if you are a lady and the discharges you are having is cottage cheese and you are experiencing itching alongside burning sensation, you are likely going to be having pain during sex. So in terms of infection, the best thing to do when you have infection and you are experiencing pain during sex is actually to get that infection treated, because once the infection is treated, the pain is going to be reduced. So to know that you have infection, you have to check for signs of discharges. The discharge you are having. You have to check for the smell coming out from the vagina. You have to check if you have burning sensation when peeing. You have to check if you have redness, if you have increase in body temperature. Are you hot? Are you feeling feverish? All these are likely signs or clues that you have infection. And if you have infection, there's an increased chance of you going to have pain during sexual intercourse. And the best thing to do is to get that infection treated. Then the second cause of pain is not infection, is actually what a condition known as endometriosis. A condition known as endometriosis. Endometriosis can cause pain during sex. It's not going to cause surface pain. It's not going to cause external pain. It's going to cause internal pain. You're going to be feeling the pain inside and not outside. Before the end of this video, I'm going to be explaining the different types of pain, which is the external and the internal pain. So endometriosis is a condition in which tissues that are supposed to be in the uterus are now outside the uterus. So people like this experience pain, like pain in their pelvic region. They experience bleeding too. So endometriosis might be a cause of that pain you are experiencing as a lady during sexual intercourse. Then the third causes of pain during sexual intercourse is vaginal dryness. Vaginal dryness. As little as the name is, like vaginal dryness, it can cause pain during sexual intercourse, because when you as a lady, like, you are not properly lubricated, that can cause pain. You are like, the friction is increased. So the penetration is not easy. Penetration is likely going to cause irritation around the vagina. Penetration is actually likely going to cause pain. So what is advised at this particular moment is for you to try lubrication using a lubricant. Some women experience this as a result of low estrogen, and that can happen when you are breastfeeding. That can happen when you are in your menopause. That can happen when you are on a particular time in your cycle. If you are a lady, you will notice that there's a particular time you are well lubricated. Those periods are close to your ovulation. But around your menstrual period, your lubrication is a bit low. So that can actually result in pain during sex. So I've talked about infection. I've talked about endometriosis. I've talked about vaginal dryness. Please and please, while this video is going on, if you have any question, feel free to drop on the comment section. Like I earlier said, this video promises to be interactive. It's me and you. It's shame-free. It's a safe space. We are all matured and we are here to help each other out. And I'm here to help you with the little knowledge I have. Okay? Then the third thing that can cause pain during sex is actually tight pelvic floor muscles. Tight pelvic floor muscles. You know, as a lady, the down part, like this down part, you have muscles around. Same way you see people saying, I have muscles here, I have muscles here. That is the same way you have muscles at the down parts. So if the muscles down there are tight, they are rigid, you are likely going to be experiencing pain during sex. What I will advise you to do if you are experiencing pain during sex and you suspect is likely going to be pelvic floor muscles, I will advise you to do the pelvic floor exercises. There are pelvic floor exercises. Just type pelvic floor exercise or Kegel exercise. You are going to see a lot of videos on YouTube, a lot of videos also on social media on how to actually do Kegel exercise. This exercise helps to strengthen your pelvic floor muscles. This exercise helps to build your pelvic floor muscles. So it's advisable for you to do that. Generally, as a lady, when going to the gym, when going to do your exercise, Kegel exercise should be part of the exercise you are doing. Yeah, if you are trying to build butt, you are trying to lose weight, add at least, even if it's 5 to 10 minutes Kegel exercise in your exercise routine. It's going to help enhance your sex life in the long run. So while you're going to the gym for other exercise, also try Kegel exercise as a lady. Then another cause of pain during sex is actually skin conditions. Skin conditions like eczema, like lichen sclerosis. Just type lichen sclerosis on YouTube or on Google. You're going to see a picture of it. So if you have that, that can likely cause pain during sex. Eczema, lichen sclerosis, this can cause pain during sex. Hello, Vera. Hello, Hawa. How are you all doing? Trust you are doing great. All you have to do if you are watching this video, double tap to like the video. And if you are new here, my name is Mercy Mary. I am a registered nurse midwife, and I also hold a master's degree in public health. So all I do is to share my knowledge and also advise you on your health. Feel free to subscribe to our YouTube channel as we continue with this video. Then another cause of pain during sex is actually recent childbirth or surgery. Recent childbirth or surgery. Like I earlier said, breastfeeding can affect your vagina, can make your vagina dried. And also when you just had cesarean section, you had vaginal tear and your tear is trying to heal, there's a scar down there that can cause pain during sex. So these are the physical causes of pain during sex. Remember, there are 3 branches I said. We have the physical causes, hormonal causes, and what? Emotional / psychological causes. So in terms of the physical causes, I've stated this and I've stated what you should do. So I talked about infection, I talked about endometriosis, I talked about vaginal dryness, I talked about tight pelvic floor muscles and what to do. I talked about skin condition, and I've talked about recent childbirth or surgery. So these are the physical causes of what? Of pain during sex. So I want to ask you a question now, and I want that on the comment section. This is just to let me know that you are following me. Okay? And the question is, yeast infection can cause painful sex. True or false? Yeast infection can cause painful sex. True or false? Drop your answer in the comment section. Hello, Elizabeth. How are you doing? Trust you are doing great. So before we go to the hormonal causes, I need answer to this question. Yeast infection can cause pain during sex. True or false? Drop in the comment section. This when you answer these questions, it gives me idea that you are following and you're understanding what I'm saying. We've listed about, I think, about 6, 7 causes, physical causes. And I want you to know actually you're following. Yeast infection. Okay, Nicola said true. Janet said true. That's to show you guys are following. Please keep the answers coming. True or false? Yeast infection can cause pain during sex. True or false? Pod Chishbu said true. That's good. I'll just wait for 2 more answers. Then we'll continue with the other causes. I'll just wait for 2 more answers. 2 people to tell me the answers, true or false. they were going to go to the other branch, which is the hormonal causes of pain during sex. True. Waiting for two. We have a lot of people watching. So we're having up to close to 30 people watching at a time. So answer that question. Do you feel yeast infection causes pain during sex? I need at least two more answers before I go. Okay, Nicola said true. Janet, true. Paul, true. Elizabeth said true. I need at least one more answer before we go into the hormonal causes. And if you have any question in regards to the physical causes, kindly drop in the comment section. This is a safe space. Express how you feel. Nobody's going to judge you. Okay? So express how you feel as much as you can. Ask the questions in the comment section. So I'm waiting for one more answer before I go to the hormonal causes of pain during sex. That's to show you're following. I just have to have this confidence that I have a lot of people listening and they understand what I'm saying. I need at least one more person to answer before we go into the hormonal causes. We have a long way to go. Somebody should type an answer. What answer do you feel it's? We have a long way to go. I don't want to waste your time. Somebody should type an answer. True or false? I need one more answer, true or false. Then I'll tell you if you're right or wrong. Why are you people not answering? Okay, let me ask the question again. Can yeast infection cause pain during sex? True or false? Can yeast infection cause pain during sex? True or false? We just finished the physical causes and we explained how it is, the signs you should look out for. Do you think yeast infection is also part of the causes of pain during sex? So I need one more answer. We've gotten 4 answers. I need just at least one more answer before we move ahead to the hormonal causes. Why are we wasting time now? Just type your answer in the comment section so that we can go to the hormonal causes, please. Okay. Thank you, Israel. So I think now we can go to the hormonal causes. As in Israel said true. So the answer to the question is true. Like, thank you, Ebu. Ebu said true. The answer to the question is actually true. You all are correct. Remember, I said one of the signs of yeast infection is actually cottage cheese discharge. Cottage cheese discharge. That's to show that you have yeast infection. So the second one we're going to be talking about is the hormonal causes. As the name implies, hormones. Your hormones are dancing. And there are some certain time in your life that your hormones dance as a woman. And the first one is menopause. So when a woman has gotten to menopause, her estrogen level decreases, thereby resulting in vaginal dryness, which is a physical cause. But the major cause of that vaginal dryness is actually menopause. Then the second hormonal cause is actually breastfeeding. Breastfeeding, I've said it in the physical cause. Breastfeeding is a cause of vaginal dryness. It's a cause of pain during sex. So if you are a man and you are out there, your wife is having pain during sex and your wife is breastfeeding, put the blame on breastfeeding and not your wife. During breastfeeding, your wife's sexual urge might not be the same because the hormones are playing the game. That's how we explain. The hormones are playing a game. So breastfeeding is there. Certain medications can actually cause pain during sex. Antidepressants. And if your wife is also on birth control, hormonal birth control pills, your wife is on birth control, like family planning. Hey, family planning. If your wife is on family planning, that can also cause pain during sex. I believe a lot of people don't know that. Now you know. So there are some certain medications, there are some certain family planning method that can result in pain during sex. So if you're on any family planning method, you are on some antidepressant medications that can alter your hormones and that can result in pain during sex. So if you are a man, your wife is on family planning, you can't put the blame on the family planning and look for a way out by the use of lubrication, doing more work, that is going to go a long way to help her. So we are done with the physical causes. We are done with the hormonal causes. Now let's talk about the emotional slash psychological causes. Sometimes we feel that emotions and psychology does not affect sex life. Emotions, psychology affect sex life, not just for the woman alone, but also for the man. Yeah, your emotions, what you are thinking, actually affect your erection as a man. It also affects the woman's ability to go wet and the woman's ability to be properly lubricated during sexual intercourse. So, under emotional and psychological cause, the first one we have is stress and anxiety. See, when a woman is stressed out, it can be difficult for her to go wet. It can result in dryness and penetration becomes painful. So, stress and anxiety is a likely cause of pain during sex. Then, history of trauma. There are some people that are holding on to trauma of rape. They've been raped when they were young, they've been abused when they were young. That trauma, they are holding on to it. And that trauma is causing psychological pain during sex. Some people are experiencing PTSD as a result of abuse, and that makes them seek sex and hate the term sex. And when one wants to penetrate, it becomes painful and it hurts. That is that. Then relationship consign. If a relationship is having issues, if there is quarrel here and there is conflict here and there, everybody is not at peace, that can affect sex life. That can cause pain during sex. Not just for the man alone, not just for the woman. In the man, it can cause it can even cause psychological pain and it can affect erection. So if your relationship is not in order, you as a man, you're not doing your duty to make your relationship in order. And also the woman, you are not working hands to hands to make that relationship, to make that marriage in order. That can result in pain during sex. That is why it is psychological. That is why we are talking about emotional and psychological. So I don't want to talk about the physical aspects, the hormonal aspect, and leave the emotions and psychological alone because these are very important. Sometimes this particular woman does not have infection, does not have any of this medical condition. All this woman is battling with is emotions, is stress, it's anxiety, is depression. So this can actually affect sex in general. Negative past experience can affect sex in general. So these are the various causes of pain during sex. I tried as much as possible to actually summarize them as much as I can so you have a better understanding of what it is. Okay, so our mind and body are connected. That's something you should know. Our mind and body are connected. If your brain does not feel safe, your body may respond with tension or pain. If your brain feel this is not safe, your body may respond with tension or pain. That is why when one is abused, when you force yourself on someone, they experience pain during sex. But when they are having it, when their mind is there, they are happy, they are excited, they are not likely going to experience pain. You've seen most sexual abuse, the victims end up feeling pain during the whole process. That some may end up having trauma from it. Okay, so the mind and the body works hand in hand. If the mind feels safe, if the mind feels loved, if the mind feels secured, then the body is relaxed. The body is not tensed. The muscles are relaxed. The muscles are not tightened. So that can result in less pain. So while we talk about the physical and hormonal causes, it's also very important and paramount we also talk about the emotional and psychological causes, which we just said. And while I was talking, at the beginning, I said I was going to tell you the difference between internal and external pain during sex, because there are different types. We have the ones that happens inside, like when you are having sexual intercourse, that is when you feel the pain on the inside. While there are some that happens on the surface, like outside, external, like you are about going in, the lady start feeling pain on the surface, like penetration, you are about penetrating and the pain is on the surface, not inside. I believe if you are having sex or you've had pain before during sex, you understand what I'm saying better. Okay, so if the pain is on the surface, like as penetration is going in, that is external pain. And most times, these external pain are usually as a result of vaginal dryness, they're as a result of infection, STI, UTI, yeast infections. But this deep pain, there is a result of something wrong within, such as endometriosis. All right, so these are the various types of pain, and also these are the causes of pain. Now, the question is, what should you do? I think for the physical causes, I've been able to explain what you should do depending on the type of pain and what caused it. All right, so in general, in summary, what you should do is to get evaluated. You can see a gynecologist, a pelvic health specialist, or a nurse practitioner. A nurse practitioner, I did not say you should come and see Nurse Mercy Mary. You go to the hospital, see a nurse practitioner, a gynecologist, or a pelvic health. There are doctors that their specialty is for pelvic. That's the pelvic floor. You know, the pelvic region as a woman, that down part, all that place where your female stuffs are, the pelvic health specialists. There are people that deal with that. You can see them. You can see a gynecologist, which is the female doctors. You can see them, and they get you evaluated and tell you what's next to do. The second thing that you can also use is lubricants. Lubricant goes a long way to help with vaginal dryness. So it's advisable to use water-based lubricants or silicone-based lubricants instead of oil-based lubricants. You can use the water-based lubricant or silicone-based lubricant. That's going to go a long way to reduce the friction between the penis and the vagina. All right. Then the third one is pelvic floor therapy. I think I explained pelvic floor exercise and when I was explaining the causes. So pelvic floor exercise is very important. I've told you before, if you are a lady, you are going to the gym, pelvic floor exercise should be part of your routine. And if you are not going to the gym, it's something you should do in your house daily. When you just wake up, just say, okay, when I wake up, my morning routine, just start with, you see yourself doing it without knowing, like 5 minutes a day, do some Kegel exercise. Before you know, like you start increasing it without knowing, you start to enjoy yourself doing that particular exercise. It might be 5 minutes a day. Before you know, you get it to 10 minutes a day. But just like be conscious, like I want to be doing pelvic floor exercise every day. It's good for your pelvic floor muscles. It's good for your sexual health when you exercise your pelvic floor muscles as a lady. That is why I say pelvic floor therapy is very important. You can see a therapist in regards to that. Then if it's an emotional and psychological pain, you can see a sex therapist. You can go for counseling depending on how severe it is. You can see a sex therapist. You can go for counseling. Then lifestyle support. One of the lifestyle support that helps to reduce pain is actually avoid irritants in the vagina. I've said it on my videos over and over again. Avoid irritants. Avoid those soaps inside the vagina. Avoid those harsh soap inside the vagina. I see some people using soap. What I mean, like, I think a lot of people are getting confused between the difference between a vagina and a vulva. A vagina is not what you see. A vagina is inside. So if you as a lady usually watch inside the vagina, it is wrong. You feel you are doing the vagina a favor by cleaning it. You're only making things worse for yourself. I am not saying you should not wash the vulva. Wash the vulva with water or mild soap if you want to. But you see, inside the vagina, there's people that go to the extent of putting their hands inside the vagina just to wash it. It's not nice. It is not good. You are not doing the vagina any favor by doing that. But you can use warm water and mild soap to wash the vulva. That's the outside part. Nobody is telling you not to wash it. So I wish I was trying to get a mannequin for the vulva, but I've not been able to see a mannequin that explains what I want to explain. So when I'm able to get the mannequin, I've been checking Amazon because I really want to explain. People are getting the difference between the vagina and the vulva wrongly. They don't really know the vulva, they don't know the vagina. So I'm trying to get the mannequin, but I've not been able to see a good mannequin that actually explains that for me. But immediately I get the mannequin, I'm going to come live and explain it in detail, especially for the women to understand what I mean when I say don't wash the vagina. Because when I say don't wash the vagina, most people think I'm talking about the vulva. All right, there's a difference between the vulva and the vagina, and that's something women out there needs to take note of. All right, avoid irritants there. Inside the vagina is self-cleansing. Like it's self-cleansing. You see most ladies battling with infection today, battling with constant itching, constant irritation. Why they are actually, and they keep telling you, oh, I keep my vagina clean, I wash it very well. That is the major reason why that infection, that irritation keep coming back, that cottage cheese discharge, that bacterial vaginosis keeps coming back, because you are altering the vaginal pH, which is not supposed to be so. Forget what you see on social media. There are a lot of misleading content out there telling ladies to wash. No, wash the vulva. While you are having some bad smell, as a lady, especially ladies with high fat, I don't know, let me try and see if I can use this my husband's PS. Okay, let's see if I can use this my husband's PS5 to explain when washing, so you understand what I mean. I think this has diverted my attention now because I'm talking to ladies now. Let's assume this is the vulva. Let's assume I'm not getting the mannequin. You see, as a lady, this is your legs. Let's assume this is your legs. These are your legs. Then here you have your vulva. Those, the bigger parts, the smaller parts. You know, you have, if you raise a flap, you see a bigger part. Then you raise another flap, you see a smaller part. So when you want to wash, I think focus on washing this side first, because sometimes there are heats around this place that you're not washing properly that causes your vagina to smell. It's not inside that is actually smelling. It's because you're not washing around properly. So wash this angle, this side of your leg that is accumulating heat. Wash this side of your leg that is accumulating heat. Wash the surface, that vulva, the upper is good. You can wash the upper and lower part with warm water. But you see inside, don't do that. You see inside the vagina proper, don't do that. And also, as a lady, when you turn, when you wash, don't wash out of the bathroom. You see the back side where your anus is, where you pass fecal matter. Put a lot of water there and wash up, like wash it very well. That anal area where you poo. Because sometimes when you don't wash properly, those poo tends to stick to your panties and they make it smell. All right. So all these things can actually cause infection that can lead to vaginal dryness. This is very important. It's even important, like it's more important than what I was explaining in this video, which are the causes of pain. Because as little as this, most ladies, they rush into the toilet and wash inside, but they forget the vital things that you need to wash. So what you need to wash, I'm going back again. These are your legs. These are your legs. Wash this side very well. Wash this side very well. Wash, I'm not saying you should not wash your vulva. Use warm water. If you want to use mild soap, okay, use warm water. Generally advised using warm water. Wash that flap, the upper flap. Wash the lower flap with warm water. But you see inside, I'm repeating it again so that you understand. I wish you understand better. But inside, don't wash. Then go to the bum bum. That's your back, where the feet, that's your poo-poo usually comes out. I know you know what I wanted to say. Wash where your poo-poo usually come outside from. Wash it very well. Put your hands at the back. I'm not saying wash inside your anus. No. Wash the back very well, those lining. And as a lady, when you go to the toilet, don't use tissue except you have no option at all. Don't use tissue. Okay, the first thing you have to do is to use water to wash it. Then you can take tissue to dry it because you don't want your pants to get wet. All right, wash that anus very well, because that anus might slit you. You might use tissue, not clean properly. You wear your panties, it gets stained a little bit, and it starts stinking, and you feel it's the vagina that's stinking. So because you're not washing this groin area, because you're not washing this part where heat accumulates here, you're not washing. You can open the flap and wash it with warm water. But you see inside, I repeat over and over again. I'll switch on the PS5. I don't know how I switch it on, or if you know how to play PS5, how do you switch this off? I was only using it to explain. Okay. Okay, I don't really know how to switch it off. I believe it's going to off by itself. I don't know how, because it's a mistake. The system is on though. So I believe I've been able to use this to explain how you should wash. Please and please don't wash inside. What is actually smelling is not inside, but the around the surroundings that you need to wash that you're not washing. So most ladies, they leave the surroundings that they are supposed to wash. They leave their bum bum, they leave the groin where heat is accumulating. They leave the surface and go and wash inside. No, you don't do that. You're altering your vaginal pH. And some people are like, oh, you have to wash. My grandmother might. No, you're altering. You will continuously battle with vaginal dryness. You will continuously battle with infection. It's not STI now. You continuously battle with those infections that results from like alteration of the vaginal pH. And you continuously, and you keep saying, oh, I took antibiotics, I took antifungal, I just treated infection, it's coming again. Sometimes it's not sex that's actually causing that infection. It's not even you. What is causing it is because you are not washing that groin properly and you are packing too much soap. You are putting too much soap inside. The only thing that's supposed to go inside that hole is a penis and a child when coming out. So if a penis is not going inside, don't put your hand inside, except you have a mission you want to accomplish by doing that. But don't put your hand inside with the mindset that you want to wash it. Don't put your hand inside with soap with the mindset that you want to wash it. You are only doing yourself more harm than good. I believe that is clear. All right. So we are talking about life support, what you should avoid, because all those irritants tend to cause pain. And also medical treatment for infections or hormonal changes. If the pain becomes unbearable with family planning, you might decide to try another type of family planning. Okay, so these are the things I really want to share with you today. And I believe and I hope this is beneficial and educating. For those that are just joining us for the first time, my name is Mercy Mary. I am a registered nurse midwife and also a member of the UK YouTube Health. All I want to do here is to educate you. I'm not here to give you personalized advice, but I'm here to educate you, but make sure and also encourage you to see the doctor if you have any major concerns. All right. So this is Mercy Mary. Everything I say here are usually evidence-based. They are not just for saying sake. They are evidence-based, and also I am a woman and I'm telling you what I practice majorly. I'm telling you what I practice and I've seen the impact. So see me as a friend. For the ladies out there, see me as a friend and also as a nurse. Okay, so we have Esther said hi. Angel Johnson said hi. How are you all doing? Trust you are doing great. So I think it's time for question and answer section. So I'm ready to answer all your questions. So Sharon KC said, please, how is pelvic exercise done? Good evening, Nurse Mercy. You're doing well. Sharon KC, pelvic exercise, you just see to make it easy, because no matter how I explain it to you, I don't have videos and pictures to explain pelvic exercise. Just go to YouTube and type pelvic floor exercise, or you type on YouTube Kegel exercise, pelvic floor exercise, or you type on YouTube Kegel exercise. And if you are someone that used to go to the gym, you can tell your instructor, your gym instructor, that see, I want this particular exercise to be included in my gym routine. If you have someone that used to guide you with your exercise every day, I think you should let them know that as a lady, you need the Kegel exercise in your routine every day when you come to the gym. That's going to go a long way to help. All right. So that's that. I don't know if Sharon Casey got the answer to this question. I don't know if she got the answer to this particular question. So feel free to ask your questions. For those that missed this live section, ask your question. I will answer. It's not too late. Then if you really want to get the full gist in this particular video, you missed, you're 40 minutes late. All you have to do is actually to sorry. All you have to do is to wait to the end of the video and watch the video from beginning to the end. So there was no gap every part of the video was in details explaining everything. So I'm going to be taking questions from the comment section now. Okay, we have Israel said, is it true that first sex is painful? And if it is true, what is the cause of that? Okay, it can be painful, especially if there is nervousness. If there is nervousness, there is lack of lubrication, there is tension. So it is normal for it to be painful because it's your first time. You are nervous, you are tensed, you are not properly lubricated. So it's normal. Okay, but that doesn't mean it should be painful every time. Like every time you want to have sex, it should be painful. It's painful. If this pain continues back to back after your first time, I would advise you to see with the doctor, to speak with your doctor. So what I advise, if it is your first time when you want to have sex, try and get lubrication around. Yeah, just like for easy penetration, get lubrication if possible. And if you are trying to conceive, it's your first time, you just got married and you know you want to conceive, I would advise you, it's better for you to have it during your ovulation, because during that period, you are usually wet, like you have this natural lubrication. And during the period of having sex for the first time, think about your partner, like think about the good side of your partner, think about all the lovely things your partner will do. Like just think about everything nice, everything positive, everything great. See it as like a new adventure, a new phase in your life. Like if you really want to go, like to enjoy that phase, see it as something great if it's your first time. Okay, don't be tensed. Because when you are tensed, when you are nervous, your pelvic floor muscles will tighten. They're like, okay. Remember, like I said that the mind and the body are related. The mind and the body are working hand to hand. So if you are tensed, it's going to affect down there. There is going to be tensed too. You understand? So that's why it's very, very good before you have sex first time. It's very good to be relaxed. You see, for those that have it first time and they were abused, it creates this trauma in them that it takes a lot to actually eradicate, because they were tensed, they were nervous, and they were in pain. So try and relax yourself, have a communication with your partner, get lubrication for easy penetration. That's going to go a long way. And like I also said, it's very important for you to use the water-based lubricant or the silicone-based lubricant. It's usually advisable rather than the oil-based lubricants. So Israel, let me know if your question is answered. Israel Ageyi, let me know if your question is answered. If you are watching this live video, double tap and like the screen. I've tried, I've explained everything you need to know. So double tap and like the video. It's going to go a long way to show that you actually are following. And if this is your first time on our YouTube channel, like I earlier said, for those that have been with us, my name is Nurse Mercy Mary. I'm a registered nurse midwife, and I hold a master's degree in public health. And I hold a master's degree in public health, where I talk about health. Sorry, just. So I'm just quickly going to do something. Let me just send a message for someone. Sorry for the break in transmission. Okay, so Israel, let me know. Okay, Israel said her question has been answered. So we have a Blessing do. Good evening from here, Nurse. Good evening, Blessing. How are you doing? Family are great. Everybody is fine. So Esther Ebu said, if someone is having pain on her nipples but is not pregnant, what's the cause? Sometimes that pain in your nipple can be sign of menses, like just mild pain. If you notice, these things usually happen at a particular time of the month. It comes and go. It might be ovulation related. It might be menses related. So that's something you should take note. It might be ovulation related. It might be menstrual cycle related. But if the pain is persistent, it's causing discomfort, I will also advise you to take note of the fact that I also advise you to be doing a breast examination monthly, like during your menstrual period. Be doing some breast examination monthly, every cycle, every of your menstrual cycle. You examine your breast and check if there is any what they call it now, if there's any lumps, anything around the breast. So just try and see if there is any. So I don't know, Ebu, Esther, is your question answered? So we have Lloyd, David. Lloyd, hi, nurse. Hello, Lloyd. How are you doing? Trust you're doing great. Ukamaka Heli said, can you get pregnant after your ovulation? If you are certain you are done with your ovulation just lasts for 24 days. 24 hours. Sorry. Ovulation just lasts for 24 hours. So if you are certain that you are done with your ovulation, that 24 hours has elapsed, the egg is no longer there, you cannot get pregnant till your next ovulation. You cannot get pregnant till your next ovulation. Angel Johnson, Annie, your questions are not appearing. Annie, your questions are not appearing. Angel Johnson, your questions are not appearing. Like earlier said, sometimes YouTube, due to their policy, might not allow your questions to appear. So what I would advise you to do is if it's to delete some letters, modify the message so it doesn't look as if you're saying something like sex, all those things. If you can modify it, it's going to go a long way for us to see it. But if not, YouTube might delete your questions. You understand? You understand what I'm trying to say? So because I didn't see any question from Annie and I didn't see any questions from NJ, and both are saying answer my question, answer my question. So if you can modify it and send it again, that's going to go a long way to help, because I didn't see any questions from Annie and I didn't see any question from somebody said, what is castrate? You're trying to ask about castration. We did a live section. We did a live section that was a few days ago where we talked about vasectomy, castration. But I'm going to be answering your question now. What is castrate? When you say castrate, it simply means they are removing a man's testicles. In simple terms, you know that testicles in the man's scrotum, they are removing it. And when you castrate a man cannot give birth again. You heard me right. When you castrate a man is no longer productive when it comes to giving birth. He cannot, because when you take away the testes, you are taking away the part that's responsible for that sperm that you see. So that is castration. They are taking away the testes. It's very from vasectomy. So YBGG68, I believe your question has been answered. Ukamaka said, how many days is your free day? Your free day. How many days? When you say how many days is your free day, if you know your ovulation, 5-7 days before your ovulation is not safe. 5-7 days before your ovulation is not safe. Then a day after your ovulation. 5-7 days before your ovulation is not safe. 5-7 days before your ovulation is not safe, because the sperm can stay in your body for 5-7 days. So 5-7 days before your ovulation, if you are sure of your ovulation, is not safe. So Angel Johnson said, I was asking about washing. I explained washing. I don't know if you get it. What do you really want me to explain about washing for you? Just let me know in the comment section. So Annie Samadia said, I am pregnant and I'm having pains when having sex. What can I do? Watching from UK. So if you are pregnant and you are having pains during sex, this is my personal advice. First of all, add lubricant. Get lubricant. It's going to go a long way to help with penetration, because with pregnancy, you come with a lot of mood swings. With pregnancy, sometimes you are not in a mood. With pregnancy, you are having hormones changing. Your estrogen is not like the way it used to be. So all these things can actually cause a decline, that can actually cause dryness down there. So what I would advise is the use of lubrication and positioning during sex, because there are some positioning, it will look as if the penis is actually hitting the baby, but though it's not hitting the baby, and that is causing you pain. So try positions that are comfortable for you, because as a pregnant woman, there are positions that are not comfortable for you, that if your husband is in a particular position, it's going to hurt you. If your husband is in a particular position, you feel better. So you have to have a conversation with your husband, or during the sex, when you are having pain with a particular position, you can let your partner know so they change style to something else that is more comfortable for you. And if penetration is difficult, you can use lubrication during that period. I don't know if I'm making sense, Annie. Does this help, Annie? Annie Samadia, let me know if it helps in the comment section. Okay. Oh, that makes sense. Wait, is scrotum? I don't understand your question. Why BBG? Yeah, the testes. Yeah, it's been removed. The testes is being removed. The testes is being removed in castration. The testes is being removed. Okay, glad your question has been answered, Annie. I wish you safe delivery and everything you need for your pregnancy. Congratulations in advance. Okay, my baby will be 6 months soon, so I gave birth in the UK here too. So my second child will be 6 months too. So Christiana Unubu said, nurse, please, as a pregnant woman, what should I do to stop craving things that are not within my environment to get? Okay, so what I would advise you to do, sometimes you crave things that are not within your environment to get. One, if you can take your mind off it, if you work, go to work. If you don't work, look for fun things, like it could be watching a movie, it could be like doing something that you love, singing. Just take your mind out of it and see if there's any way you can substitute that craving with something else. Okay, as far as not within your environment, the best thing is to take your mind off it. So what I did during my personal time, I think I was having cravings, but I'm in the UK, but my cravings were actually things that are in Africa that I cannot even get, like throughout my course of pregnancy. So personally, what I did was like, oh, it's normal to feel hungry for things. Just program your mind that I just programmed my mind automatically, like, no, I can't allow these cravings get a hold of me. Because if I cannot get it, it wants to make me feel miserable because I can't get that particular thing I'm craving for. So the best thing is to get my mind off it and just see that pregnancy as a normal thing. Because when you start programming your mind that pregnancy comes with a lot of cravings, pregnancy comes with a lot of craving, it's normal for me to crave, it's normal for me to crave for human head, it's normal for me to crave for cow goat meat, it's normal for me to crave for fire smoke jollof rice. You will crave for it continuously. Just see that pregnancy if you can. I am not like imposing it on you. If you can, that was what I did. I said, I have to tell myself, pregnancy is a normal thing. Mercy, you have to eat what is available. Mercy, you have to be, sometimes you just have to be hard on yourself, or else if you are not hard on yourself, it's going to like, oh, I can make meat pie. Where are you in the U? Are you in the UK? Where are you? I can make meat pie. Okay, I was craving meat pie, which is within my environment. Maybe I should come to your house tomorrow. Who is talking? Who is Christiana? I make meat pie. I will really make meat pie for you if you are around. Seriously, I will, because I crave for a lot of things. What I just do, it's like I take my mind off it. But if I have friends that can do it for me, I usually contact them and they do it for me. But if it's not what you can get, then let me know where you are. If you are around my place, definitely I'm going to make meat pie for you. It's a promise. If you are close by, I will make it. I make meat pies, and yeah, I do make meat pies. All right. Okay. I wish you safe delivery, Christiana. I wish everybody pregnant on this live safe delivery. If you have any questions in regards to pregnancy, feel free to ask. I'm going to be who is this Christiana? Ah! Now I get. Okay, I'll make the meat pie for you. Fine. I know her. Now I know her. So I'm going to be making the meat pie for you. It's a promise, just for me to get the meats, the minced meat. I think I have everything in the house. It's just the minced meat I don't have. So I'm going to make the meat pie and send for you. I know the person now. It didn't come to my mind. Immediately she said, I'll make the meat pie. It's a promise. But I have to look for a way to get the minced meat. That's the only thing that's not in my house for meat. But I have the flour, I have everything. So I'm going to get a minced meat and make it for you, okay? So we have another question. Let me answer another question like boss. So we have Annie's. Okay, Annie said the question has been answered. Which city are you in? I'm in Oxford, Annie. Which city are you, Annie? Let me know in the comment section. Angel Jensen, another thing, I am always dry. What can I do to improve? When it comes to vaginal dryness, like I will always tell you, you are always dry. Try lubrication. Lubrication is going to go a long way to help. Then also, you can see what causes vaginal dryness. There are also some psychological and emotional causes. Are you sure those emotions or psychological factors are not playing a role in it when it comes to vaginal dryness that you're experiencing? If you feel it's not part of it, try lubrication. I will start with. Try getting lubrication, either water-based lubricants or silicone-based lubricants. Try using that. Try programming your mind. Like, I think women out there need to program their mind that sex is fun. Yeah, sex is, like I always say, sex should not be a one-party thing, because if as a woman you feel, oh, the only reason I'm having sex is, one, my husband should not go outside to cheat. Two, I want to have children. Maybe three, I want to, like, you give films like funny excuses why you really want to have sex, then that is not it. You're not going to have fun while having sex. As a lady, I will advise you, for you to like have that mindset you're having sex, you have to like see it as fun. I'm here to have fun. I'm here to enjoy it. It's not this man that's going to like enjoy this thing. It's a two-way thing. We are here to enjoy it. We are here to have fun. Trust me, the feeling you're going to be get is going to be different when you're having this mindset of, I'm just trying to satisfy my husband. No, it's a two-way thing. You have to like have that mindset. Start creating positive mindsets when having sex. I think I've made a video about that, why women find it difficult to enjoy sex. Because as a woman, you have a lot going through your mind. You have your kids, you have your baby, you have family, you have work. So many things are going through your mind that getting wet or getting lubricated becomes a problem. When you want to have sex, take everything out of the radar. Take everything. When I mean everything, anything troubling you, anything that's not going to make you happy, take it out of your mind. Focus on the present. Focus on the fun things you will do. Focus on the exciting thing about sex and do it. Then what I've seen from the comment section and also from the messages I'm getting is the fact that most women feel like, oh, they start feeling less of their body. Yeah. They start, either they say, okay, I'm too slim. I don't have the big ass. I don't have the big, they just discriminate themselves by themselves. No. Take all those negative aspects out of sex and focus on the good thing with a mindset that I'm here to enjoy sex and nothing else. So I'm not here to just do the thing and go. So I think you should put that at the back of your mind. So that's what I have to say. Angel Johnson, I hope that answers your question. So I think most people are going because we are done with the topic for today. And I believe that helps a lot. So Blackpool, where's Blackpool? I don't really know where is Blackpool. I don't know where is Blackpool. Where is Blackpool? I'm not really like a travel person, but I'll check. But I'm in Oxford. I don't know how long Oxford is from Blackpool, but I live in Oxford area. Around that Oxford, that's where I live. So I think we've had a lot of questions today. Do we have any more questions? Kindly drop in the comment section. And if you are watching this live section, just double tap the screen and like the video. And if you've not subscribed to our YouTube channel, kindly do so now. If you've not subscribed to our YouTube channel, kindly do so now. Kindly click on that subscribe button. So I have actually come live today. I was having a double thought about coming live today, but I had to like, oh, Mercy, you have to do this. People are waiting for you. Yesterday, I could not come live. What happened? What happened yesterday? Yesterday, I had some things I have to do. I have some prep things that I had to do. When are you coming up again? Tomorrow. The D was to be coming live every day. We started coming live every day, but yesterday I could not make it because I had to like do one or two. Then day before yesterday, my hairstylist came to make my hair. That's the inside of my hair. Came to wash, treat my hair, and she came late. So she actually finished 12 a.m. in the morning. Yeah, she actually finished treating my hair, washing it, and making it 12 a.m. in the morning. Yes, day before yesterday. So that was why I didn't come live day before yesterday. And yesterday I was preparing homemade Cerelac because I like my things organic. So I bought all the organic things. So that's why I didn't show up yesterday. Tomorrow, definitely I will be live. Yesterday, I was preparing my kids' Cerelac. I was trying to, because my child has started eating some solid food. So I was trying to use this homemade soya beans, corn, just to prepare their food. So that was what I was doing yesterday. So that was why I did not come online. But after today, you see me more often like you always do. Usually 10 p.m. I usually come live. But today I came earlier because they slept earlier. So that's God's gift. God's gift. Did you get that? So we have Ukamaka said, after your period, how many days is free? Depending on your cycle. That is why it's very important for you to know your cycle. I've explained the benefits of knowing your cycle on this channel over and over again. It is very, very important for you to know your cycle. So if you don't know your cycle, do I have my marker here? So this is my board. What I can do, I can help you calculate it if you don't know your cycle, so you know when you are free. Because if you don't know your cycle, you won't know how many days you are free after your period. But if you have idea of your cycle, you're able to know how many days you are free after your period. Okay. So Esther said, my period is kind of dark. Please, what will I do? It's been a month now. So dark period, when you say your period is kind of dark, does it mean throughout the period, from the beginning of the period to the end of the period, you experience dark period? Or day one or the last day of your period, you experience dark period? Or it's just dark throughout? And how long has this been? When you say it's been a month now, are you saying the period has been going on for a month and it has not stopped? Is that what you're trying to say? Esther, let me know in the comment section. Edge said, I asked about some white particles that comes out on the penis sometimes. Infection. If it's during sex or after sex, that white thing discharge that come out might be pre-cum or something. Sometimes it's not infection, but some discharge might signify infection. So sometimes these things are pre-cum, remnants from sperm that were deposited, not fully deposited. It comes out and you see it. So it might not be something of concern. But if the discharges are usually coming out from the penis, it's not supposed to be so. Then you have to see the doctor. It could be an infection that needs to be treated. All right? So let me know if your question is clear. If you're just coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse midwife. I'm a registered nurse midwife and I own a master's degree in public health. So that's why you see me often, to help educate you. All right. I own a master's degree in public health and I'm here to guide you through, especially fertility, your sexual health and reproductive health. Though I am not a sex therapist. I am not a sex therapist. I am not a gynecologist, but I'm a registered midwife in Nigeria. So whatever I'm telling you here is like a general advice, but for personalized advice, see your doctor. So Ukamaka said, please help me calculate my cycle. To help you calculate your cycle, I will need the start date, the day your period starts in April, the date your period starts in May, and the day your period starts in June. I will need that 3 date to be able to calculate it. If you can't get it, it will be difficult for us to calculate that for you. Esther Ebu said, yes, from the start of the period to the end, since 2 months. How many days did you see your period? How many days are you seeing your period when it happens? How many days? How many days did you see your period when it happens? Three days. Do you have any symptoms? Because normally you're not supposed to see a dark period blood throughout. You're not supposed to see a dark period blood throughout. That's my concern. You're not supposed to see it throughout. If it was on the last day, close to the end, it will say yes, it is. But for you to see it throughout, if you have any symptoms attached to it, I will advise you speak with your doctor. I might need to get my marker. Okay. So what's gonna happen is, Ukamaka, you have to get your calendar too, because this my camera it's not going to be showing the numbers properly because it's mirroring the image. I'm using the front camera, but I can calculate it, but you might not be. But I want you to understand what I'm doing. So I would advise you to get your calendar while I'm using this one so that you understand. I want you to understand. So get a calendar too. Ukamaka, get a calendar too. I'm going to explain it. I want to get a marker. Just give me like few seconds. I'm coming. So I've gotten my markers now. So we are going to help marker calculator cycle. Let me just create more space. So I'm going to help Ukamaka calculator cycle, but you people will not see the board. You can see the it's actually mirroring the image. You are not seeing, one is looking like, two is looking like Z. So Ukamaka, what I would advise you, for you to understand this, I will personally advise you get a calendar. You get your calendar. That's going to make you understand proper. So Ukamaka, you said in April, this is our April calendar, but you're not seeing it. Just wait a bit. Let me calculate the one for Ukamaka first. April, you saw it on the 13th. I'm going to mark on the 13th. This is 13th of April. In May, you saw it on the 12th. So this is May. You saw it on the 12th. I'm going to mark 12. Ukamaka, as I'm doing it, you'll be doing it too. Okay? Ukamaka, mark April 13th. Mark it in your calendar. May 12th. I want to mark it in my calendar. You mark it in your calendar. May 12th. Mark it. Then June. You said you saw it June 11. I'm going to mark June 11 in my calendar too. So we're going to be calculating Ukamaka's cycle. So if you as a lady, this is an opportunity for you to learn too. You can get calendar and also learn. Because this is mirroring the image, you might not understand. So if you mark, what you are going to do is to count days from this 13th in April to a day before the next meses. A day before the next meses. You count how many days interval. Don't count the day of the next meses. You count till the day before the next meses. That is one cycle. Okay, so I'm going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. So the first cycle between April and May shows 29. So I'm going to write 29. All right. Then the second cycle between May and June, I'm going to calculate. I'm going to calculate between May and June. So May started 12. So we're going to calculate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 27, and 27. The other one is 27. I don't know if I'm right. Is somebody calculating? So the first cycle for Ukamaka was 29, and the second cycle for Ukamaka was 27. So the first cycle was 29, and the second cycle was 27. So what is advisable to do is to get an average, which is 29 plus, let me calculate, 29 plus 27 divided by, where's my division here? Let's see if I can get some division. Okay, 29 plus 27 is 56. 56 divided by 2. 56 divided by 2 is 28. On an average, Ukamaka has 28-day cycle. So what I will advise Ukamaka is that 14 days, generally, let's just say 12 days. Is it 12 now? Should I say 12? No. 10? No. 7 days. Let's just say 7, 8 days after your menses, you are safe. From the look of things, okay? 7, 8 days after your menses, you are safe. Because on the 14th, you are seeing your menses. So 7, 8 days after your menses. Is it? Should I say after your menses now? Yeah. From the start date of your menses, 7, 8 days, you are safe. Do you understand, Ukamaka? I want to know if you understand. You have a short cycle, which is around 28, 29 days. So your safe days are usually like the first after your menses. Ukamaka, do you even understand what I'm trying to say? It's like I feel I'm getting somebody confused. Let me look for a way to break it down now. Looking at it, Ukamaka has, let's just say she has 28 days cycle on an average, 28 days cycle. Okay, so 28 days simply means 14 days. The first 14 days, she's going to, on the day 14, she's going to see her ovulation. If day 14, she's going to see her ovulation, generally 5-7 days before ovulation is not safe. Okay, so 14 minus 7. So 7 days from your menses is free. 7 days from the day you started your menses is actually safe. 7 days from the day you started your menses is safe. 7 days from the day you started your menses. I'm not talking about after your menses has ended. From the day you started your menses. 7 days from the day you started your menses is safe. Do you understand, Ukamaka? Let me know in the comment section if you understand. So Josh Kryptonite said, Nurse, I love your passion. Thank you very much, Josh Kryptonite. Thank you very much for the comments. So we have Sharon Casey said, hello, Nurse. My cycle seems to be regular, not to be regular. Please assist me calculate the cycle to be sure. Mine started April 25th, May 24th, and June 21st. It looks good. Okay, Ukamaka said she understands. So we're going to move to Sharon Casey now. Let's see what Sharon Casey have. She said her cycle seems not to be regular. Please assist me calculate cycle to be sure. Mine started April 25th. So where is April? This is April. So, okay, sorry, you're not seeing it. Like I earlier said, this board might look confused, but if you have a calendar, just obey the instructions I'll be saying. Okay, so we're going to look for April 25th. You said in April, it started April 25th. So this is April 25th. Let me use the red marker for you. This is April 25th. I'm going to mark April 25th. Then the second one started May 24th. 24th. Then the other one started June 21st. 21st of June is here. So I'm going to calculate now. What you are going to calculate is the day, April 25th to May 23rd. Count how many days between. So that's our April 25th to May 23rd. We're going to calculate how many days in between now. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Same thing with Ukamaka. The first one is 29. Let's see the second one. 29. So we have this is 23, 24, 25, 26, 27, 28, 29, 30, and 31. So this one is 31. So 29, 31, 29, 31. So the first one was 29 and the other one was 31. So let's calculate. Let me use my calculator here. So it's not like 29 plus 31. 29 plus 31 is equal to 60 divided by 2 is equals to 30. So it's more or less like you are having an average of 30 days cycle. You are having an average of 30 days cycle, and there's a possibility your ovulation is going to be day 15, day 16, day 15, day 16, day 15, day 16. So 7, similar to Ukamaka, 7 to 8 days from the day you started your menses is safe. 7 to 8 days from the day you started your menses is usually your safe day. Your ovulation day is likely going to be day 15 or day 16. Do you understand? Your cycle is regular. Irregular cycle is like it's something that if the cycle doesn't fall between 21 to 32 days, that's irregular. If your cycle is less than 21 days or is more than 32 days, is irregular. And also, if your cycle, the differences between the dates is up to 7 days or 10 days, then it's irregular. But from the look of things, it's just how many days? Just 2 days difference on an average. So that cycle looks okay. That cycle looks regular. So we can't say it's irregular. So generally, if you want to be getting accurate cycle, you don't want anything to alter your cycle. So you are safe. So you know you're safe and you're safe period. Avoid unnecessary medications. Medications that you know is not important. For example, most of us, when we just have headache, the next thing we have to do is to take paracetamol. Sometimes your body doesn't need that paracetamol. What your body needs is rest. Just sleep. You'll be fine. Okay? So if you know there is no need for a particular medications, don't take it. If you know what your body needs is rest, take that rest. All right? Because sometimes all these medications we take, even malaria medications, can actually affect your cycle. I'm not saying you should not treat malaria. I'm just trying to tell you that things like that tends to alter your cycle. If you were having 29 days cycle, you might check and you will see 30 days. You might check and you will see 40 days. Stress, especially for those that are trying to conceive, those that are trying to get pregnant, stress can actually affect your cycle and it's difficult for you to track down your ovulation. Okay, stress can affect your cycle. Drugs can affect your cycle. Those concoctions that they cook for you up and down to help with fertility can affect your cycle. It just make everything worse in the long run. So we just have to be careful, okay? In general, you just have to be careful. All right, if you are watching this video and you missed the first part of it, which was talking about the causes of pain during sex, all you have to do is to wait to the end of the live and watch the video. You are going to be getting everything we've talked about on the video. Okay, because now we actually diverted to sort out the questions from our audience. So that's why we're not talking about it. Because I don't really like when I click on the video and I've seen them talking about something whereby the title says something. So that's why I'm explaining it for those that are just joining us. All right. And if you've not subscribed to our YouTube channel, kindly do so. Kindly subscribe to the YouTube channel. And if you've not liked this particular video, kindly like this particular video. Double tap on the screen and it automatically like the video. So Sharon Casey, let me know if your question has been answered. Sharon Casey, can you let me know if your question has been answered? Do we have any questions for me in the comment section? Do we have any questions for us in the comment section? All right, if there is something you want us to talk about tomorrow, can you drop in the comment section? If there's a particular topic you want us to discuss tomorrow, can you drop in the comment section? We're going to be talking about it tomorrow. Because this live will be coming to an end. We spent 1 hour, 22 minutes. In baby blessing, you just came in, you're late. You are late. You are late. You are late. You are late. All right, God's gift said, which days are unsafe? The days that you will get pregnant, they are the unsafe days, especially when you are not trying to conceive. So those days that you are likely going to get pregnant, they are known as the unsafe days. They are the days you should not have sex or probably use withdrawal or condom if you are so intent on having sex. Because when you do, you're going to get pregnant during that period. So that's why they are termed unsafe days. Okay. So unsafe days are the day you are ovulating. For example, for someone with 30 days cycle now, the day that is unsafe is actually from since day 15 is ovulation, from day 9, from day 8, the person is unsafe. From day 8 of the cycle, the person is unsafe. I'll just say to be secured. From day 8, you are unsafe. Because when you have sex, it's the sperm can stay in the body for up to 5 to 7 days. So 5 to 7 days before your body releases egg is actually unsafe if you don't want to get pregnant. So Sharon Casey said, yes, it's answered. God bless. God bless you too. If you've not subscribed, kindly subscribe to our YouTube channel. Turn on the notification button so whenever we come live, you get a notification and actually run down to watch the live video. So we usually go live from 10 to 11 p.m. But today we came live early. I think we came at about 9:30, 9:40ish, because my kids actually slept on time today. My baby slept on time. So for my daughter, like I always tell you, she has been sleep trained, so she sleeps by 8. But for my son, he's still little, so I'm still trying to sleep train him. So that's why it's my coming life alternates between 9:30 to 10, 9, 10, 9, 10, because he's still trying to sleep train to 8 o'clock routine, but he sleeps majorly from 8:30, 9ish. So I'm still trying to adjust him to a particular routine. But my daughter is already sleep trained. Just my son, he's still young. He's just 6 months. He will be completing 6 months soon. So Precious said, please, how do I contact you in private? Send a message on Instagram and book an appointment. But if you have any question, feel free to drop. This is a safe space. Nobody knows you here. That's why I like YouTube. That's why I like talking about things like this on YouTube. Or like Facebook, everybody has your handle. Everybody know your social media handle. They're able to track down and know you are the one asking this particular question. But for YouTube, I don't think most people know each other, except you are very close. You know your names on but for YouTube I think is more exposed. But Facebook is more exposed. It's easy for you to know people. So that YouTube is like, I think it's a safer space to ask your questions. Okay, feel free to ask your questions, Precious. If you don't want to book an appointment, just ask your questions here and I will take the questions. And if you are watching this video, all you have to do is to double tap the screen and like this video. Okay, Sharon Casey said, how do you sleep train your kids? Okay, I think we are out of the contest, but I'm going to explain because of Sharon Casey. I sleep train them at a very young age. You can see my son is just 6 months and he's already sleeping. Yeah, I start sleep training as early as 4, 5, 6 months. Yeah. When I started sleep training, my daughter sleeps 8. 8 on the dot, she knows it's her bedtime. Yeah, it's her bedtime, Nothing is going to happen by 8 except, sorry, I don't know if it's her room. Just give me some time. Something fell. I'm going to come back again. Please and please, for those that are live, I just heard a sound upstairs. So I'm just going to come back again. Just give me some time, please.